glycosylation profile in maps using time-dependent media supplementation. In order to meet desired drug product quality targets, the glycosylation profile of biotherapeutics such as monoclonal antibodies must be maintained consistently during manufacturing. Achieving consistent glycan distribution profiles requires identifying factors that influence glycosylation and manipulating them appropriately via well-designed control strategies. Now the cell culture media supplement magnesium chloride is known to alter the glycosylation profiles in MAP generally, but its effect, particularly when introduced at different stages during cell growth, yet has to be investigated and quantified. In this study, we evaluate the effect of time-dependent addition of magnesium chloride on the glycan profile quantitatively using factorial design experiments. Our results show that magnesium chloride addition during the lag and exponential phases affects the glycan profile significantly more than the stationary phase supplementation dose. Also, using a novel computational technique, we identify various combinations of glycan species that are affected by the dynamic media supplementation scheme and quantify the effects mathematically. Our experiments demonstrate the importance of taking into consideration the time of addition of these trace supplements, not just their concentrations, and our computational analysis provides insight into what supplements to add, when, and how much in order to induce desired changes. The global market for pharmaceuticals is predicted to grow to 1.5 trillion by 2021, with biologics such as monoclonal antibodies, hormones, and therapeutics enzymes accounting for nearly 20% of the market share based on current projections, with US sales rising from 8.29 billion. And our one important post-translational modification is in MABs is an glycosylation, a process by which an oligosaccharide transferase complex in the endoplasmic reticulum adds the sugar substrate glycan to the ASNX serum SER THR motif in the heavy chain of the map. As the map transfers the Golgi complex, the core glycan undergoes a series of non-template driven reactions that are mediated by localized glycotransferase enzymes in the different Golgi compartments. The result is a heterogeneous distribution of glycan residues or glycoform, which affects the aminogenicity, effector functions, and the pharmacokinetics properties of MAB, and consequently the final drug product quality. There is considerable motivation for manufacturers and regulators to understand, characterize, and if necessary, modulate the glycoform distribution in MAVs during production in order to maintain a consistent glycan profile. However, manipulating the glycan distribution effectively requires identifying the factors that can influence the glycan distribution, quantifying the degree to which these factors affect the concentration of glycoform species, using such information to design effective control systems. Previous studies have demonstrated that protein glycosylation can be influenced by various factors such as pH, temperature, dissolved oxygen, ammonia, and media supplements such as nucleotide sugar precursors and manganese chloride Each study focused on an individual factor, establishing empirical relationship between the individual factor in question and the specific set of glycan species it affects. However, modulating the complete glycan distribution profile requires manipulating multiple input factors simultaneously, and to be effective, such action must be based on a thorough, holistic understanding of how these inputs individually jointly affect various glycan species. Such process understanding can be generated systematically by using statistical design of experiments, whereby input factors are judicially varied simultaneously to generate data on them, or really depends. In most cases, however, the available input are fewer than the glycan species to be controlled, resulted in a system with insufficient degrees of freedom. Consequently, we must first answer a fundamental question. Given a limited set of input, to what extent can we independently control the concentration of all desired glycan species? In other words, is the desired change in the glycan distribution achievable using the available inputs? We address this question using controllability analysis, by which we can determine quantitatively the extent to which the system is controllable. The role of different media supplements in modulating critical quality attributes of the MAB in general and the glycan distribution profile in particular has received considerable attention recently. Typically, supplements such as magnesium chloride, which are known to affect the expression and activity of several glycos glycosyltransferase enzymes, are added to the media at the start of the batch to alter the glycan distribution. However, over the course of the batch run, as the cells continue to grow and produce MAB molecules, it is clear that changes in the cellular availability of supplements will influence not just the antibody productivity but also the activity of the glycosyl transferase enzyme, thus affecting the final glycan distribution. Consequently, we postulate that it is possible to control the glycosylation profile in MAPS by introducing specific media supplements at different stages of cell growth. We postulate further that introducing a chelating agent to the media can alter the effect of magnesium chloride addition on the glycal distribution. Consequently, a chelating, agent such as EDTA provides an additional degree of freedom for fine-tuning the effect of magnesium chloride, the media supplement of primary interest. Although EDTA is toxic to cells and titrate both magnesium and other bivalent ions in the medium that are necessary for cell growth and may be cofactor for other glycosyltransferase enzymes. It has been used in this study primarily to elucidate the effects of a dynamic addition of two media supplement. It is important to stress that the proposed time-dependent media supplementation is distinct from current fed batch strategies where the objective is primarily to meet nutrient demand in the culture. All experiments were conducted using an IgG1 producing CHO-K1 cell line donated by Genentech, San Francisco, California. The cells were scaled up in a custom CD-Opti CHO medium formulation that was supplemented with 4 millimolar glutamine, 5 grams per liter glucose, and 25 nanomolar MTX.
Por algún motivo está... No.